This video is not created by professional. It's just me who searched and verified or experienced all information in this video. So it's just tentative and amateurish. Hi there, I'm Jane. Welcome dear. Welcome dear. No, welcome here. Okay. Hi there, I'm Jane. Welcome here. Do you know what mental disorder is? Mental disorder or mental illness are health conditions that affect someone's thinking, feeling, mood, and behavior. They may be occasional or long-lasting, in other words, chronic. They can affect one's ability to relate to others and function each day. Such disorder may be diagnosed by mental health professional, usually a clinical psychologist or psychiatrist, according to standardized criteria. What causes mental disorder? There is no single cause, but a number of factors can contribute to risk for mental illness, such as genes and family history, life experiences such as stress and history of abuse, especially if they happen in childhood, biological factors such as chemical imbalances in the brain, traumatic brain injury, having a serious medical condition like cancer, use of alcohol or recreational drugs, a mother's exposure to viruses or toxic chemicals while pregnancy, or just having a few friends and feeling lonely or isolated. Mental disorders are not caused by character flaws, and they have nothing to do with being lazy or lame. There are many different types of mental disorder. Some common ones include anxiety. Anxiety disorders are characterized by persistent worry, fear, and stress that interferes with one's everyday life. Anxiety affects 284 million people. Depression. Depression disorders are characterized by persistent low mood, fatigue, and profound sadness. Depression affects 264 million people. Bipolar disorder. Bipolar disorder consists of radical shifts in depressive or low moods and manic high moods that can last weeks long. Schizophrenia. Schizophrenia is characterized by a failure of thought processes and reduced ability to perceive and respond to emotions. Most commonly is exhibited by auditory hallucinations, paranoid or bizarre delusions, or confused speech and thinking. Eating disorders. Eating disorders are illnesses that affect a person's relationship with food and body image. Eating disorders affect 16 million people. Borderline personality disorder, BPD. BPD is characterized by a long-term pattern of unstable interpersonal relationships, distorted sense of self, and strong emotional reactions. Obsessive compulsive disorder, OCD. OCD is chronic, long-lasting anxiety disorder when a person experiences unreasonable, uncontrollable, recurring thoughts followed by a behavioral response. Post-traumatic stress disorder, PTSD. PTSD is disorder that develops in some who have experienced a shocking or dangerous event, have difficulty recovering from the trauma that the event caused. These were just a few of them, which are the most common. Globally, mental illnesses affect more females than males. It is estimated that mental disorders are attributable to nearly 14% of deaths worldwide, or approximately 8 million deaths each year. 50% of all lifetime mental illnesses begins by age 14, and 75% by age 24. 4% of people experience major depression and more than 7% experience anxiety in Czech Republic. Around 20% of the world's children and adolescents have a bad mental health condition, with suicide the second leading cause of death among 15 to 29 years olds. Mental health conditions can have a substantial effect on all areas of life, such as school or work performance, relationships with family and friends, and ability to participate in the community. Two of the most common mental health conditions are depression and anxiety. Furthermore, these problems appear to be increasing. According to World Health Organization, depression will be one of the biggest health problems worldwide by the year of 2022. Mental illnesses cause a huge deal of suffering to those who are experiencing them, as well as their families and friends. But as a parent, friends, family members, or as a close person, you can protect your loved one's mental health with understanding and supportive relationships with them. So this video is for all of you who want to know how to support someone with mental health problem. Sometimes it's helpful to make a comparison to physical illness. For example, many people get sick with a cold or the flu, but only few get really sick with something serious like pneumonia. People who have a cold are usually able to do their normal activities. However, if they got pneumonia, they will have to take medicine and may have to go to the hospital. Similarly, feelings of sadness, anxiety, worry, or sleep problems are common for the most people. However, when these feelings get very intense, last for a long period of time, and begin to interfere with school, work, and relationships, it may be a sign of mental health problem. And just like people need to take medicine and get professional help for physical conditions, someone with a mental health problem may need to take medicine and participate in therapy in order to get better. Firstly, you and person you are worried about should start a conversation about mental health. Try leading with these questions and make sure to actively listen to your friend or family members' responses. Sometimes it's even more important how you are saying it than what you are saying. So please, when you are talking about mental health problems, communicate in a straightforward manner. Speak at a level appropriate to a person's age and development level. Discuss the topic when and where the person feels safe and comfortable. Watch for reactions during the discussion and slow down or back up if the person becomes confused or looks upset. Express your concern and support about the person. Reassuring your friend and family member that you care about them is one of the most important things.
So, it takes me so long to film this, and at this point I literally couldn't speak. That means next clips are from different day. Sorry, loves.
When you are talking about their mental health, find out if the person is getting the care they need and want. If not, connect them to help and encourage treatment. Remind the person, your friend or family member, that help is available and that mental health problems can be treated. Together you can find some professional who can diagnose more specific what mental problem it can be. Offer to help make those first appointments with the doctor to find out what's wrong, or accompany the person to the doctor. If you do accompany the person, write down any notes or questions. Learn about the disorder and its causes and symptoms. Also learn more about how treatments work so that you know what side effects and improvements you may see. Usually your loved one is going through this distressing condition and it's difficult for them to concentrate on problems and they will probably have a hard time remembering things. Please be patient. Getting better can take time. Don't assume you know what a person needs. Ask how you can help. Listen carefully and practice active listening. Active listening is one of the best ways to show your support. It is different than just hearing what a person has to say. A good active listener puts everything aside and gives their complete attention to the person who is talking. Ask open-ended questions to get more details about the topic that is being discussed. Takes a moment throughout the conversation to summarize what they have been told and make sure they are understanding clearly. If you ask and get a response like "nothing, I'm fine," and you see it's not true, offer up a few suggestions for things you would be willing to do without being pushy. For instance, you could offer to come sit with them and watch a movie, cook them a meal, or pick up a few things for them at the store. Provide emotional support. You can play an important role in helping someone who is not feeling well to feel less alone and ashamed. They are not to blame for their illness, but they may feel that they are. And it's absolutely okay if you don't know what to do. That's usual, but the person doesn't want a solution from you. They need a support and understanding. Help encourage hope. Don't compare. If a friend or loved one is going through a tough situation and they come to you for support, you might feel tempted to tell them about something that happened to you and how you were able to get through it. It's okay to share about similar experiences, but please be careful not to compare. It can make someone feel like their pain isn't valid. Focus on what you did to cope with feeling of loss or loneliness. Don't judge. To be truly supportive of someone, you need to put your personal opinions and biases aside. They may be struggling because of a mistake that they made, or you may think that they are overreacting. But you will never know what it's truly like to be that person in this moment, and criticism is not helpful to their recovery. Offer to join them. Offer to help your friend or family member with everyday tasks. When someone is going through a time of sadness or uncertainty, their emotions can take over and leave them feeling paralyzed and unable to take care of life's obligations. Sometimes for them absolute human needs, as eating, sleeping, and going to the toilet, and others, seem impossible. So don't be mad about them for not cleaning their room, for eating too much or too little, for not drinking enough water, or for their sleeping habits. Offering to go with someone to help them take care of responsibilities like walking the dog, going to the grocery store, attending doctor's appointments, or cleaning their room can help them feel a sense of accomplishment and lift their spirits. Keep yourself and the person safe. If there's a risk of violence, make safety a priority. Regarding physical or verbal abuse, set limits that you can keep. For instance, state that you will leave and call the police if your loved one becomes physically violent. And also, if your friend or family member says hurtful things, it helps to listen for the emotion behind the words rather than focusing on the words themselves. Try to recognize and acknowledge the pain, anxiety, or confusion rather than getting into unnecessary arguments. Discussing your plans for these situations ahead of time can make them more manageable. Express your support out loud. Spoken encouragement can reduce stress level. You don't need to say anything fancy. Practice a few simple, gentle statements like, I'm sorry you feel bad and I want to help, or it isn't your fault. It can happen to anyone. People with mental disorders are often insecure and feel inferior. With showing support and assurance, you help them to feel calmer. And it applies to normal daily tasks and even for their dreams, plans, or life choices, unless they are life-threatening, of course. Keep your word. If you have offered your support to someone and told them you would do something, keep your word. When a person is struggling, the last thing they need is to feel abandoned by someone else. If you absolutely can honor your promise, make a sincere apology and find another time that you can do what you said you would do. Compliment them. Who don't like when someone appreciates them? Always be honest about it and mean it. You can compliment something about their personality. You can say which favorite character they remind to you, what they did you like, or remind a funny joke they made. I think it's always more intimate than compliments about appearance. However, compliments of looks can be heartwarming too. But please never comment about size, color, or structure of their bodies. Much better is saying general things like, "You're beautiful," "You're handsome," or compliment their clothes, makeup, or how they did their hair. Resume normal activities and routines. Spend time together on activities unconnected to illness, such as watching a movie, eating dinner out, or visiting a favorite park. Include your friend or family member in your plans. Continue to invite them, again without being pushy, even if your loved one resists your invitations. Practice living life with a mental health condition rather than struggling against mental illness. Set boundaries and don't take on too much. If you become unwell yourself, you won't be able to support them or yourself in the same way. It is also important to decide what your limits are and how much you feel able to help. Don't give up. You make a big difference in your friends' or family members' life and recovery. Remind them that you are there to help and you're not giving up. Good life is possible. It may take longer, but with you, the chances are higher. This was how you can regularly support someone with a mental health problem. If your loved one's disorder includes attacks, you and your friend or family member need to find a specific plan how to stand them or how to function with them. But in the caption of this video is prepared a document in English and Czech. We developed the crisis plan for panic attacks, which can work for you, or you can use it as template for your own plan. As you can see, from big part, it's about treating people with mental health problems with respect, compassion, and empathy. Recognize the signs so you can offer help to yourself or your loved ones who are suffering. That's all. Thank you for your time. You matter, you are valid, and you are so loved. I wanted to apologize as well because English is not my first language and I know I have a horrible accent, so I'm so sorry, and I hope it was clear what I was saying.